Here we are talking about Bahrain experience with sickle cell, especially our country is facing, as every country in the world facing COVID-19. And while the sickle cell patient or warrior struggling much finding during this pandemic, finding the care. And let's escape this and let's go to talk about what's Bahrain exactly, and what is the map of Bahrain. In population, we are only a little 1.6 million in population. We have 65K living with the sickle cell gene trait, and who live with sickle cell is 9,000 people. We live in 200 kilometers square. The life expectancy here in Bahrain is the normal people, the healthy is 75, while the sickle cell we expect 65. How we perform, let's give a dashboard on how their record is going. We have confirm we are highly infected country. Yes, we are a very small country, but we have a very high number who get infected with COVID-19. 2000, 12,000, 200,000, 12, which is very high. Recovery is also 193K. And the death is very high, also 809 up to 22nd of May. While number of sickle cell infected with sickle cell or with COVID, 114 shows out of 9,000, we had 144 infected with COVID, and number of decays of within sickle cell is 9. Once the pandemic attacked the country, we were having a lot of services being missed, and was lots of area need to be care and look at it. The doctors, because our center being taken, we have a center of excellency for sickle cell being taken away and made it for as they made it as a temporary place for an ICU isolation for COVID, while shifted all sickle cell patient to the normal ward as before. So, and also our doctor and nurse being taken to serve with COVID. So we are dealing with the new doctors with the new experience dealing with sickle cell. So we have an area doctors, an emotional threat that people is losing their job. People, they are panic what to do, and their immunity is very less. And what they do during the VOC, how about their jobs, how they secure their job. Who were they are in regular appointment, getting a blood transfusion or exchange, how they are going to do. And the sickle cell center, after it's gone, and the emergency, we are dealing now with the emergency accident and emergency new area, where before we are going to the center while being look after sickle cell to deal with the emergency room again. And misinformation and lack of information, how we do with that, and communities, and everybody is blaming everybody. And OBD, the outpatient department, where the clinic, we have a multidisciplinary clinic where the sickle cell find or to see their doctors every 5 to 6 weeks. How we are going to manage during this pandemic. So at the first, we have to look at what is Bahrain sickle cell, how the platform they do have, the power. We have a good network, and we have 7,000 followers on Twitter, and we have 6 hotlines. We receive a very few calls daily. One of these 6 lines is only for doctors who and the answer, the other part who's going to answer this line is doctor answering the doctor's question, dealing with the new experience with the sickle cell, experience with the COVID with sickle cell, with attack, how they perform and how they get the knowledge. So there is a doctors who answer one of these 6 lines to answer, and one of these lines, also another line for this patient who's out of a station or away from the country, so they can communicate with their doctor. Even the doctors who's in their area, in geographic area, anywhere in the world, they can communicate with the doctor. So this hotline is open 24 between the doctors, and the others for the patient to share them and to feed them with the knowledge. The WhatsApp, this is the highest use. We received around 16,000 message a day, and in Instagram we have 19,000 followers. Through this network, we are communicating with our communities, our sickle cell community. What we did at the emergency, we went and we have split the work. First, we made sure that every patient has the awareness when and how and what to do when he get in VOC, or when he get a COVID. So we need to give him the awareness, and we locate a private area for sickle cell to make sure that everybody will get his treatment, and proper care will be given to the patient during this pandemic. And also we have written, this is an opportunity, actually, it was an opportunity for us to write or to teach or to guide the emergency doctor about the guideline, what to do during pandemic with the sickle cell. And that should go through training and several meetings. And the result was only 45 minutes is an average waiting time when the sickle cell patient entered the emergency till he received his treatment, within 45 minutes. So the type of information given to the patient is about when and when I should go to the hospital, and what I should do when I get this and that. And we made sure that every patient had enough medication, either it is opioid or any other analgesia, or any medication of hydroxyurea, of etc., just in case of lockdown is happening, or difficulties he faced difficulties reaching to the hospital. Also, we made a number of sessions, non-pharmaceutical treatment, like a yoga, and to help them to divert this pain and to deal with this pain during this crisis. And one of the benefits, that number of people who believe or to go for hydroxyurea being increased. And hotline and the hospital, during the VOC management, we made a private ward where even during the pandemic, every sickle cell who need to be admitted to hospital through a private entrance, and nobody can enter this area. And also limited access to food or flowers from outside, just to secure our patient. Visiting hour mean reduced from 4 hours to 2 hours, rather 7 days a week, made it 3 days a week, just to reduce the interfere with others. And number of days admitted to minimize 3 to 5 days as a maximum. Blood transfusion, one of the and the unit transfusion unit and exchange unit, one of the area where we face lots of challenge, fear that patients they hesitate to go hospital, or even to receive their treatment, or to this donor who's going to donate the blood, they are hesitating to go, and we make sure that ensure the safety is there. And the blood level stock, every area being attacked, and we have done as procedure that to postpone number of the whole and emergency surgical procedures, new surgical procedure being implemented, and to postpone all unnecessary and not urgent surgical. We encourage more people to donate by ensuring there is a green line that people can go safely to the blood bank and donate and go within 20 minutes. And blood exchange transfusion continue as regular, not interfere, not interrupted. For the OPD appointments, outpatient appointments, we went for telemedicine and telecommunication, where we had been used this 2 years ago. At that time, the legal part said, no, it is not legal. We cannot do this in the treatment. But today, I think within the new experience, we've been forced to go for this. And because we had an experience 2 years before, I think it was easy for us to go. It was ready to go and to use telemedicine. And actually, before we were able to see our doctor or patient can see their doctors within 6 to 8 weeks. Within the telemedicine, they can see their doctors every 2 weeks, more frequent rather than 8 weeks. And the medication delivery door to door, not to make sure that patient less contact or less visit to the hospital, so all medication will be delivered to their door. Lack of information, we were very provider. We were gathering information as a trusted information resource for patients or the community, and the hotline made that less threat of getting misinformation, either for patient or doctors. So for doctor awareness, we had taken this opportunity to increase using the new technology, Zoom and etc., the different platform, to do more management meeting about crisis, to do more practice, more training and practice, and more negotiation and protocol about sickle cell management with COVID. Involvement in educating community. We made doctors to be invited to the community to talk within the community, sickle cell community or public community, to talk about several things. So to make sure the awareness, doctor awareness, get that, to be very close within the sickle cell community, and several meeting being and training being held during this period. And also we received a government support for sickle cell warriors during the pandemic. Online, we were working, governmental, made all sickle cell who had sickle cell can work from home, not anymore going to work. Schooling also being online, and bank loan being postponed for a year. Electricity and power paid by government for 10 months, and the housing paid by government for 6 months. Vaccination was free for everybody in the country, all the time, all the varieties. It was an option for the patient. Business support for these sickle cell patient who got a business. They've been paid wages, rents, electricity, and tax waiver. And for those who lost jobs, no jobs opportunity, and unemployment payment for these who lost jobs. We call it black swan. Yes, it was a crisis, but from a crisis we had fruits out of that. We've been used telemedicine, medicine delivery. This is all a new experience, e-meeting, and this all saved lots of time. Good data. We gather good data. We were struggling to get good data. Today we have a very huge data to use. Bahrain sickle cell become a reliable source of information. We are up-to-date guideline with emergency, being improved, updated, and highly trusted as a partnership with decision maker and policy maker. They look at the sickle cell, Bahrain sickle cell, as a great partnership. We have a highly influence. We show others, we show the government, we show our community, we show our people that we have a high influence on our patient, in our doctors, in our community, and people, they are listening to us. Bahrain sickle cell, our strong partner, able to manage patient during a crisis, and this is achieved. A new experience we learn all, either patient or doctors or care provider or decision maker. Everybody learned a lesson. Patient felt safe, secure, and emotionally being saved. They are not panic. They are not any more panic. Importance of vaccination program that will help the community and will make a community strong. Thank you.